Hi, everybody. I'm Dr. Duc Vuong, world-famous bariatric surgeon. I want to talk about why the hospitalization numbers are actually a lot worse than what people are reporting. All right. And so today's video is really about hospitalizations. And even though these vaccines are coming to the frontline workers, it's actually worse than you think. So number one, all right. So for all of the deniers, these people have such confused logic. They'll, in one hand, they'll say like, oh, these cases are inflated. These numbers aren't real. They're diagnosing other diseases. They're diagnosing flu. They're diagnosing car wrecks. Comment if you know someone like that. Okay. Here's the fucked up logic. All right. So comment if you know someone who thinks that this is overblown because, you know, they're lying about the diagnoses, they're lying about the cases. It's not really that bad. Okay. That's one hand. In the other side of their fucking mouths, in the other side of their mouth, they'll say something like this. They'll say, yeah, but you know, how many people are they really testing? Right. So what they're thinking in their head is if we tested more people, if we tested everybody, then it's not as bad as it seems. So that way, by that they mean the death rate's going to be lower. And so that this was a hoax, it's a farce, it's a control thing. We didn't really need to shut down. It wasn't as bad as it was because we're not testing everybody. So therefore, it just seems worse than it really is. Well, listen to me, Uncle Billy. You can't have it fucking both ways. Which way do you want it? Okay. And then on the third corner of their mouth, they're saying, oh, the numbers are only high because we test so much. What the fuck's wrong with you? Like, where's your logic there? Makes no sense. Do you want us to test everybody to show that the death rate's actually lower than reported? Or do you want to stop testing? That way our numbers doesn't seem so high, a la the, you know, our president, our current president, who's soon to be out of here in a month. Do you want to use that logic? Or do you want to say, oh, no, the cases are actually lower because doctors are a bunch of fakes and phonies and they're lying on the death certificates? This is how illogical people are. This is how confused and angry and frustrated they are. So what I want to do is, one of the things like I do these lives for is because I try to cut through the bullshit for you guys. So when Uncle Billy, when Aunt Sally, when they start talking like this, you can easily point out their delusion. Like you can easily say, listen, that makes no sense. Which way do you want it? Do you want the death rates too low? Do you want to say we test too much? We don't test enough? You want to say that, hey, these healthcare providers who are taking care of our cousin, who's taking care of our aunt, who's taking care of our grandmother, they're lying? We want them to do their best stuff. We want the doctors to treat our loved ones, but somehow we want to believe that they're dishonest. We want to believe that they're lying. You can't have it both ways, yo. In fact, that was one of the videos where I was like, dude, this is just fucking bullshit. To sit here, but from the president of the United States to say that doctors are lying about numbers so they can get higher reimbursement is a fucking joke. It's a farce. It's an insult. It's so insulting. But so for someone to sit there and repeat it just goes to show you like how screwed up they are in their heads, how they can't have common logic, right? How it just makes no sense. It's gotten so bad. It's gotten to the point where I actually quit going back and reading the comments because you can't even argue with these people. So if that's you, I don't need your comments. I don't need your likes. I don't need your shares. Get the fuck off my page. Just go away, crawl into your hole. I used to be like, I love you, stay safe. And now I'm to the point where I'm like, yeah, just fuck off. Because I can't convince you. You can't tell people. You can't change their mind. Oh, Dr. Vuong, you keep saying you're political, but you point to like our president. Dude, if our president was a Democrat, it's not political. It doesn't matter. I'm not angry at the political party. I'm disappointed by the person. It's the person. It's not the politics, guys. And the fact that you think that I'm one way biased, one way or the other. Listen, you don't know me. You don't know my politics. You don't know how I voted. I didn't vote. You don't know if that's true or not. I could have lied. Look, I just lied. No, I didn't. See, you don't fucking know. I'm sober. I'm drunk. You don't fucking know. Rather, you don't know. But you do know the fucking behavior, don't you? You know that Uncle Billy's confused. You know that people are saying different shit. They're very confused. They don't know what they're saying. Let's go to number 2. Why are these numbers higher? Okay. So hospitalizations are actually higher. All right. One of the things that's weird, right, that we're starting to see is you're starting to see reports about, hey, the medical system is pushed to its limits. We are at 80% capacity, 90% capacity. Hospitalizations are actually higher than what's reported. No, Dr. Vuong, we have meetings. I know, I sat in through all those meetings. No, we are at 95% capacity. We're at 90% capacity. There's this hospital in Las Vegas who's opened up a ward in the fucking parking garage. They're seeing patients in the parking garage. Never in my life would I have thought that this would have been the case where you'd have to actually practice medicine in a freaking parking garage, okay? Now, let me tell you, is that reported? If you see patients in a parking garage, do you report that? Is that because, we are under guidelines in hospitals. You are accredited. Hospitals are accredited for a certain number of beds. This hospital has 10 ICU beds, has 20 ICU beds, whatever the number is. Now, what happens if you open up a parking garage? What happens if you put up a white tent? What happens if you turn your convention center into a hospital? How does that figure into your hospitalization rate? Bet you never thought about that, did you? You just assumed that's part of the count, Uncle Billy. Oh, they're lying. These doctors are lying so they get more reimbursement. What fucking doctor wants to work in a parking garage? You tell me, Uncle Billy. Like, what the hell? They get paid more. They're going to make away like bandits. Really? You're on Social Security. You're on Medicare. You're not even paying for this shit. You don't have no clue. You don't have 2 nickels to rub together. And somehow you've become this financial guru who knows what reimbursement is for insurance, for hospitals, for all their billing, for their back pays, co-pays, non-deliverables, blah, blah, blah. Somehow now you have a degree in accounting and hospital work. Hospital administration. Here's your PhD in hospital administration because you seem to know doctors and hospitals are making away like bandits because we get to code a car wreck as a COVID case. What the fuck's wrong with you? You have no clue how much it costs to take care of a patient who's been in a car wreck, do ya? Stupid. I get pissed, man. I get so pissed. All right, so first of all, what do you do about all these extra beds? All right? God, can I hear some amens? Can someone give me some love here about the stupidity, about what's going on, Right? Maybe, right? Fucking Billy. Come on. Give it up. Ignorant, not stupid. Come on. What is wrong with people? Can I have some amens? Amens. Thank you, CL. Nicole Hoover. Amen. Sick of it. CL. Lisa. Brian. Brother. God, it's so silly. Like their logic is not even there. They don't even know. They have no ideas. They think let me tell you something real quick. Uncle Billy still thinks $1 million is a lot of money. These doctors are making all these money by coding things COVID. Oh, yeah, how much? $1 million. Oh, my God, $1 million. You think that's the number in healthcare? You think that's a lot of money? That's a fucking rounding error. That's a rounding error. I told my boss one time, my nurse practitioner, my PA, my physician assistant left. And it took us over a year to find a replacement. And that whole time, I did her job plus my job. And at my 2-year review, I told my boss, I was like, I've saved the system some money. I've been doing the work of 2 people. I saw her patients, I see my patients, and I'm saving them her salary and their benefits, and it's $150,000. And he was like, while I appreciate your work ethic, Dr. Vuong, he goes, it really isn't that much money. It's just a drop in the bucket. Now, I know some of y'all will get triggered by that. Some of y'all will think that's a shit ton of money. That's a great salary. That's a way, whatever. Dr. V, you should be pat on the back. Dr. V, you're delusional. Dr. V, whatever. It doesn't fucking matter. It doesn't matter your feelings. I'm telling you, it's just not that much money. It's just not that much. And it doesn't matter how much money's coming in, dickhead. It's how much money's going out. If they give me $1 million, but I have to spend $1,000,001 on a COVID case, you lose money. No one's making money on this, dickhead. Like, it's just so crazy, right? Oh, but they get paid 20% more. Who cares if we get paid 20% more if it costs us 21% more to care for that patient? If they're on the ventilator for 3 weeks, if they take up an ICU bed for 4 weeks, because that's not in our algorithm. We know the average, this heart bypass should be in the ICU on average 4.5 days or 2.3 days or whatever your protocol is. This particular surgery has this number of ICU days. That means that ICU bed is occupied for 3 days, 4 days, 5 days, and then we know it will be available. Fucking COVID comes along. Now, we don't fucking know if they're going to be in the hospital, in the ICU, on the ventilator for 3, 4, 5 days, 6 days, whatever. We don't know. Oh, but you're making a killing. No, you're not. What is wrong with you? No, they are not. People the numbers are high because doctors are lying about the number of cases. Dude, go crawl under a rock. Can't talk to you. All right, let me get to some other shit real quick, okay? Hospitalizations are actually higher. Why? We have lowered. All right, this is the big point here. So screenshot this one. I have a typo, okay? Here's the problem. Who remembers the springtime? Everybody was looking at Italy, then Paris, then Madrid, then England, and then our turn, New York City. Everybody was looking at New York City. These nurses were coming in from all over. They were, because New York was running out of nursing staff, and doctors were getting called out of retirement. Right? And the world is watching New York City, and we saw all these ICU pictures and all this sort of stuff. Okay. And these hospitals were getting bloated and full. We were admitting people because we didn't know what we were dealing with. We didn't know what was going to happen. Right? Yeah, Dr. Vuong, that's the problem. It was a hoax. We totally made it a big deal. See, my cousin, he had it. He got over it. He didn't die. And I know 5 people who got it who didn't die. Listen, motherfucker, we didn't know what we were dealing with. So we were admitting patients, and we watched them. And then we started hearing reports. Dude, they tank fast, right? Here's the stuff that Uncle Billy doesn't know. In the springtime, while this was happening, doctors, because we were fucking shut down. So we had no other ways to really communicate. So what were we doing? We took to social media. There are lots of Facebook groups for COVID physicians. Treatments, the latest. So we're in these groups trying to figure it out. Well, the first thing we realized was like the people in Washington state where it first started, then moved over to New York, et cetera. They were saying, hey, listen, guys, this is bad. This is worse than you think. I know Washington was the hot spot, right? But listen, it's like It's worse than you think. These patients are tanking. They're going fast. You know, they're on the floor. They look good. You round on them in the morning. You think they're going to be fine. And that afternoon, they're being intubated. Guys, we are in our Facebook chat groups talking about this stuff back in April. And we're like, dude, you can't take your eyes off them. They're going fast. And hey, you know, we're doing PEEP. We're doing all the stuff. And then a month later, we go, no, you can't use PEEP. PEEP is bad. PEEP, it blows out their alveoli. It blows out their lungs. And then suddenly you start seeing these conspiracy theories. Like, we're trying our hardest to figure this shit out, right? And these fucking stupid ass people doing these conspiracy theories are like, doctors are killing patients. They're ventilating. They're blowing out their lungs. They're causing this. And then you have these stupid videos about they're treated. It's actually like it's altitude. Who remembers the fucking altitude sickness? The doctor who's like, I've treated these patients and this is like altitude sickness. It's not pneumonia. It's not ARDS. It's this. And then all these people suddenly got their Google MD. Who remembers all this stuff, man? And then it starts coming out like, oh shit, there are blood clots. There's microemboli. And all these fucking people had opinions. The day before, they never even knew the word emboli, and now they're suddenly experts on microemboli. They don't even know what micro means, much less emboli, but somehow I'm getting all these messages about these microembolis, right? And then these doctors are getting paid more, and this, and it's overblown. And now look at this. Okay, so here's the problem. Here's the problem. Fast forward, December. Today is December 12th, 2020. The numbers should be worse. If we kept the same admission criteria that we had in the spring, the hospitals would be overwhelmed. You guys understand that, right? If we continue to admit people today like we were doing back in May, we would be out of hospital beds all over the United States, okay? We are sending people home. Comment right now if you know someone who was having trouble breathing, they're COVID positive, and they got sent home. Okay? So, number 3. And it's not right or wrong. It's just, we just have to manage the systems. Okay? All right? Okay, here's the thing. Patients are being sent home. I'm not saying that's wrong. I'm saying that's the state. Back in April, they would have been admitted because we didn't know what we were dealing with. Now we know if they look a certain way, if they're younger, if they're healthier, if they have 2 brain cells, if they have connectivity, right? If they have Wi-Fi, we can send patients home. We can monitor them remotely. We can get on a Zoom call. We can send them home with home oxygen. We can monitor them. How far do you live? Oh, you live a mile away, right? Come back here. And we stress this now. We say, don't go to another hospital. Come back to the same hospital. It's called continuity of care, fucking Uncle Billy. Quit fucking hopping from I didn't like how they treated me at that hospital, so I'm going to go to this other hospital. Don't fucking do that. Your records are at this first hospital. They know you were there 3 days ago. They know that your numbers are worse. They need to admit you. They've already tried sending you home. Listen, these doctors are overwhelmed. These nurses are overwhelmed. They're going to drop the ball. It's not a fault. It's not wrong. It's not malpractice. It's just the state of where we are, okay? So by criteria from the spring, these hospitalizations should be higher. We are at 109,000 people hospitalized. We should be double that. We should have way more hospitalizations. Does this make sense? Does this make sense? Okay, so in the spring, you had a hospitalization number. Follow me. December, winter, we need now, we don't have it, but we need a hospitalization number plus a at-home number. How many COVID positive people went to the hospital, got tested to be positive, but they are being cared for at home, not sent home, not abandoned, not turned away. We are extending our healthcare reach. We are treating you at home. How many patients are being treated at home with remote monitoring, with home oxygen, with, hey, nurses calling you? Who's the responsible adult? The wife, the spouse, the daughter? There's like, there are 13-year-old kids, 14-year-old kids who are the only responsible person at home that has to sit by the phone. And when the nurse calls that morning, here's your window, 9 to 10 a.m., 10 to 11 a.m. There are 13 and 14-year-old kids who have to take that phone call because they're the only ones at home and give the report to the nurse or the nurse practitioner or the doctor. It says, how's grandfather? How's your mom? How's your dad? How are you breathing? Breathing okay? What's the number on the little thing on their their pulse oximeter? What's the number reading on their finger? Oh, it's at 91. It's at 92. Good. How much oxygen? What's the number on the little oxygen machine with the turn knob? It's at 2. It's at 2. Okay, it's at 2. Now listen, young little Mary. You need to turn that number up to 2.5. How scary. How scary for a 13-year-old daughter to have to do this. And we still have people who thinks this is a hoax. We still have people criticizing their governors and mayors for shutting down restaurants. What is wrong with you? I know this is hard. It's time to adult up. I know our leadership hasn't been perfect. I know that they are about 3 months behind passing a stimulus bill. I know this is all needed. I know this money shouldn't have gone to big chains and restaurants and big businesses and should have gone to small business owners, mom and pop stores. But being angry about it's not going to fix it. You not wearing a mask is not going to fix it. You denying it is not going to fix it. You need to cancel your Christmas celebration. You should not be gathering. You should not be traveling. You should not be getting on an airplane. These numbers are worse than being reported. Comment if this is the first time you've heard anybody explain it like this. There is a hospitalization numbers, roughly 109,000 people in the United States in hospitals right now. But we also need another number. How many patients are being watched at home that are not being reported? Oh, there's only 16 million cases. Someone yesterday, I did my COVID yesterday, said LA has 10,000 cases. Today, LA has 10,400 cases. And this dickhead says, there's 10 million people in LA County. What's 10,000? And I went, dude, that's 10,000 in a day. It's not 10,000 total, dickhead. It's 10,000 in one day. It's just a matter of time before we cannot sustain this. So we need a whole new number for patients being treated at home. Okay? We don't know these numbers. Hospitalization numbers are worse. We don't know this number. We don't record this. Here we go. Here we go. Screenshot this. We don't know the psychological, traumatic impact that this is having. Open up schools. We need to go back to schools. Why? My kid is hyperactive. That's your fucking problem. That's your fault. Quit giving them sugary candy. There are things to do. We have to get past this. It's one semester. I've been saying this since the summer. It's one fucking semester of college. Why did they open up college this fall? Stupid. Greed. Now we have these huge vectors coming home for the holidays called freshmen and sophomores in college. It's awful. Sports, football, really? The Super Bowl? You're going to have the Super Bowl in Florida? Really? During the peak, mid-January is the height. It's going to be the peak of the pandemic. Why? Why are we having the Super Bowl? You can't sit there and complain about the psychological impact of this. Dr. Vuong, depression, anxiety. Like, listen, people like to use these little catchphrases, right? The cure can't be worse than the disease. Really? People are committing suicide, drug abuse, drug overdoses, abuse at home. Really? You don't think I've known that? Of course. But you get past that by getting over this. How many more people could we have helped if we had just stayed locked down like Europe? If we had just worn our masks like Europe? If we had a normal second wave like Europe and like gone over, surpassed it? If we had followed Australia and shut down our borders, shut down the borders between states, fined people, Australia's gone back to normal life. Yes, they still have to wear masks. But look at Australia. They're in the southern hemisphere. They have warm weather. Canada did the same thing. Their downside is they had winter. So people are congregating. So they're going to have a small increase. But they have 6,000 cases. They don't have 260,000 cases. It's crazy. Oh, but it's a population thing. Oh my God, you're not going to outsmart me on this. It's per population, dickhead. That's already factored in. Stop it. Be a grown-up. These numbers are worse, all right? Despite what you think. A last thing. And then I'm going to eat lunch. Listen. Believe me, the community numbers are far worse than reported. We are just starting the Thanksgiving surge. This is the start. We are going to fly through 300,000 cases a day, every fucking day. Just like right now, like we used to panic about maybe hitting 100,000 cases. And now if we had a day where we had 100,000 cases, we would be like, woohoo, see, it's working. Look at that. American ingenuity. Told you it was a hoax. Whereas before we were paranoid about getting to 100,000. We are going to fly through 300,000 cases just like we flew through 200,000 cases. If tomorrow suddenly we had 200,000 cases, we would think like, oh my God, it's so amazing. We're so awesome. See, it's a hoax. What is wrong with people? These numbers are far worse. Listen, Arizona dickheads, your positivity rate's 25%. 1 in 4 Arizonans who test have COVID. Who test? See, Dr. Vuong, they're not testing enough. See, Dr. Vuong, they're testing too much. Which way do you want it, you confused motherfucker? Which way do you want it? The numbers are the fucking numbers. It's worse than you think. Multiply it times 10. Multiply it times 10. That is really what we are dealing with, guys. These hospital numbers are worse than they look, and they are going to get much worse. Okay. I love you. I was going to test myself, but I'll save it for tomorrow. I can't do this. I'm going to go eat. It's dark times. Winter has this weird effect on people. Daylight, lack of sunshine. It's a gloomy day today. It's been raining all day here in Houston. You get into these moods. You don't want to deal with it. You read comments. You look at people, things people say, and you sit there and go, Here's the problem. You go, oh, these are Russian bots. This is not even a real person. They don't have a profile pic. It's a bot. A lot of them are bots. A lot of them are fake accounts. But a lot of them are not. A lot of them are not fake accounts. And I think that's what's really horrifying. A lot of them on YouTube are actually really people who really, really believe that this is all a hoax. And you know what's fucked up? It doesn't matter if they think it's a hoax. You're going to have to wear a mask. You can think this is a hoax. Wear your mask. You can think that this is, you know, a travesty against your rights. Fine. Wear a mask. Stay at home. You think that like your next door neighbors, your best friend's business is being shut down, they're going to lose their livelihood, or it could be you. Fine. Wear a mask. File for bankruptcy. Like we all are going to, like there's going to be, if you're a lawyer right now, if you're in law school right now, this would be a great time to focus on bankruptcy law, because you're going to be really fucking busy the next 2 to 3 years. It's just a fact of life. It doesn't matter what you think. It doesn't matter how you vote. It doesn't matter what you believe. It doesn't matter. It is for real. It's here. It's worse than you're being told, because nobody in real media, on television, on radio is going to come on and tell you to fucking mask up. No one's going to come on and call you a fucker like I do. It's just what it is, man. I don't like it. I don't want it. But do what's right. Do what's right. And listen, as always, for our first responders, our healthcare workers, prayers and wishes to our doctors, our nurses, our assistants, our phlebotomists, our RTechs, our labbies, our orderlies, our hospital crews, housekeeping, prayers and wishes to them. Let's just do our part, guys. Let's get beyond politics. Because right now, if you are posting that this is a hoax, if you are posting that the numbers are a lie, you just look like a dickhead. Why? Because somebody has lost a loved one. And you are just a penis, man. I'm just telling you. I was going to test myself, but I'll do it tomorrow. I'm too depressed. Love you guys. Be safe. Be kind. Take care of each other. Bye.